If your child has cough, cold, and if it's starting to show ear symptoms, do not neglect and please get it treated as soon as possible. So a tonsil in an adult will not give you those jaw anomalies and dental anomalies.
But will they give sleep apnea problems?
100%, 100%. People complain that, I have a lot of foul smell. So one of the commonest causes for that is mouth breathing.
Oh, is it? Okay.
Yes.
Hello and welcome. I'm Dr. Arati and welcome to a new episode of my podcast, Talk Tonic, India's leading podcast channel for medical science and health. On today's episode, like every other episode, we are getting you the leading experts of every specialty. So for today, just for y'all, we have Mumbai's leading ENT surgeon, Dr. Sohil Gala, who will be discussing certain important aspects of ear, nose, and throat ailments, which are extremely important not just for parents, but you as young adults also. So let's dive in. Sohil, for being on this podcast today. We are very grateful.
The pleasure is mine, and I hope we have a wonderful discussion today.
Sure,
Yeah.
let's hope.
Yeah.
So my first question to you is that today we have a lot of audio devices for listening to music, etc. And there's wireless earphones which are Bluetooth connected. Then there's the wired old-fashioned earphones, and then there are headphones, those big chunky ones.
Yeah.
Now, can you tell the audience what is the safest option and which is the worst option in terms of hearing problems that each of them can create?
Okay, yeah. So, of course, like you already said, there are many devices. So, first thing when we are talking about hearing, it is important that you are considering the distance of the device from the ear.
Okay.
So, if you are plugging in the ear AirPod or a earphone which is going in the ear, which is of course going to be more damaging compared to something which is outside the ear.
Okay.
So, ideally, a headphone will be better than a earphone.
Because the distance is more.
Because the distance between the device and your parts of the ear are a little more than that.
Okay.
Coming to Bluetooth and wired earphones, there isn't a major difference. And now if we see majority of the newer phones, devices barely have the wire connectivity.
Correct.
So I think we are shifting to wireless connectivity for anything and everything. So that's not a major issue.
My next question to you is that wax buildup, like you said, with earphones also or any other issue, it's a quite commonly observed issue. Even in Indians, and Indians have this habit of cleaning the ears either every Sunday with a earbud or with a chavi or toothpick, whatever they find.
Correct.
Can you tell the audience how unsafe this is? What are better, safer medical alternatives to this? What mishaps have you seen in your practice because of such incidences?
Okay, so firstly, wax is not a problem. It's a normal secretion of the ear,
That's
which is supposed to protect your ear. It lubricates your ear. It has antiseptic properties. So wax in small quantities is required for the ear. So one thing is you don't need to clean it.
Achha.
Only when the wax buildup is a lot, is when it's blocking your ears, it's giving you discomfort, is when it may need cleaning. So we don't normally recommend earbuds, hairpins. हमारे पास बहुत सारे पेशेंट्स आए हैं जिनको ईयरबड्स या हेडपिन से काफ़ी इंजरीज हुई है. वर्स्ट केसेस में भी इवन सीन जो आपके कान का पर्दा होता है, इट इज़ नॉट टू फार अवे. वो आपके कान के बाहर के पार्ट से सिर्फ 2.5 या 3 सेंटीमीटर पे होता है. उसको भी द ईयर ड्रम, कान का पर्दा जिसे कहते हैं. सो दैट ईयर ड्रम ऑल्सो कैन गेट वेरी इजीली डैमेज्ड इफ यू आर नॉट केयरफुल व्हाइल यूजिंग दोज pins or earbuds. So we've had a lot of patients with injury, with bleeding. So we don't recommend all of these things to clean the wax. But if you need to take care of your ears, things which you can do is there are a lot of wax dissolving drops. So we recommend parents, especially for children, to use those drops maybe once a week.
Okay.
So whatever little bit wax is there, it just becomes softer और वो खुद से बाहर आ जाता है.
Correct.
And in worst case scenario, when you think that there is a genuine problem and there is a lot of wax buildup, then usually we have some patients who have to come to us once in 6 months or once in a year and just get their ears cleaned periodically. But that's only few people who have a major wax problem. But otherwise, we don't recommend any such cleaning methods.
All right, because I remember one such incident did take place in residency where this patient had gone to a quack on the road.
Yeah.
Those who clean the
Correct.
ears with
Correct.
those long sticks or something.
Yes.
And apart from the wax, he had got those three bones in his hands
Oh my
which are
God.
inside the ear.
Yes,
So there
100%
are three
possible.
bones which are present inside the middle ear, which are very important for conducting the sound from the outside to the brain. And that patient had got all the three bones in his hand because of this ear cleaning. So that's why when you said that these patients do come to you, I just
Absolutely.
immediately remembered this
Yeah,
case.
yeah. So you spoke about quacks, as in those people
Hmm.
who clean on the road. We get a lot of those patients, but more commonly they come with infections, fungal infections,
Ah,
because probably I don't know how much sterility or how
ah,
much, how
correct.
clean those instruments are. But yeah,
Yeah.
so definitely don't go for such cleaning methods for sure.
So, Dr. Sohil, a lot of kids when they get cold, cough, fever, general upper respiratory infection, जो साधारण सर्दी खांसी होती है, तो can the ears also get infected in that? What would be the telltale signs which a parent should be knowing that okay, now ear infection is happening in this child and needs to get the child probably to the ENT person, or maybe should just be aware that there's a ear infection going on.
Going on. Yeah.
Hmm.
To answer that question, I'll say one thing that the ear, nose, and throat, आपका कान, नाक और गला, they are very delicately connected with each other. There is a tube which is called as eustachian tube, जो आपके कान के middle part और नाक को connect करती है. In adults, the tube is in a sloping direction where the ear end of the tube is at the higher level and the nose end of the tube is at a lower level.
Okay.
But in small kids, the tube is almost straight.
Okay.
So because that tube is straight, it is easier for that cold or that infection from the nose and throat to easily travel to the ear.
Okay.
So which is why we see that children who have common upper respiratory tract infections, सर्दी, खांसी, उनमें कान की इन्फेक्शन होने की चांस ज़्यादा होती है.
Okay.
So as parents, what you need to see is if your child is suffering from cough cold, which is persistent, say beyond 3 to 4 days, and if the child is also complaining of some amount of ear pain, or if he's having some negligible amount of ear discharge, or if he complains that he feels the ear is heavy. So if it's an older child who's 4 years and above, they'll be able to tell these subtle signs and symptoms. But most importantly, look for ear pain, the child complaining that the ear feels heavy or they are hearing a little less. So which means that the cold has started affecting the ear. So this is when the cold needs to be properly treated so as to prevent or control the ear infection as soon as possible.
What happens if it is not controlled, this ear infection, if it is just ignored or the child is not able to tell this? Can it be harmful to the ears?
Yes, absolutely.
Severe infection possible?
Yes, so a mild infection can lead to a severe infection, and severe infections can eventually lead to damage to your eardrum, जो आपका कान का पर्दा होता है. So if that gets damaged, if it gets damaged once, twice, it may repair by itself, it may
Okay.
heal by itself.
Okay.
But when such infections are happening again and again in that child, in the child's journey, this leads to chronic problems where the patients may even have hearing loss, which may eventually need surgeries.
Okay.
And you just spoke about those three bones.
हाँ.
So when the infections are happening again and again, there is a chance कि वो जो 3 bones होते हैं जो आपकी sound को conduct करते हैं from outside to the brain, वो bones को भी damage हो सकता है. So definitely, if your child has cough cold and if it's starting to show ear symptoms, do not neglect and please get it treated as soon as possible. To add to this, we get a lot of parents who come to us that the teachers have started complaining that the child who used to otherwise sit on the last bench and was able to communicate and talk to us now is not hearing from there and has to sit on the first or the second bench. So that is a lot of times when the parents realize and they come to us and we see the ear and we actually realize that this was because of a cold or a nose infection where the child developed a hearing problem. So the
Okay.
child may not have symptoms, but sometimes the school sends complaints to the parents that the child is not listening or hearing properly or following instructions. So that's another very common presentation. Yeah.
All right, okay. And what about tonsils? Tonsils, something that every child, almost every other child, is going through some kind of minor tonsil infection. But then there are those children who have recurrent tonsillitis. Tonsils literally like swell up, and then they are looking for surgical options.
Yeah.
When should a child undergo surgery for removing tonsils, or when should an adult undergo surgery? Is there a fair point where we decide as a surgeon that okay, this is the right time to actually remove the tonsils now?
Yeah, so a lot of factors to be considered. First is the age. So we do not usually recommend a tonsil surgery to a child who's below 3.5 years of age.
Okay.
Till that age, the tonsil is a part of the immune system. It
Acha.
helps the child to develop some form of antibodies and immunity to a lot of common infections which he encounters. After 3.5 or 4 years, we can get the tonsils out. So now I'll tell you in which children should the tonsils be considered to be surgically removed.
Okay.
So first part is recurrent infections. So if I have to give you a number, so what would you call recurrent infections? So if the child is having 6 to 7 infections requiring antibiotics or absence from school in that particular year, so the child has had an infection probably every second month, that is an indication for a surgery.
Okay.
Now, if the child has had 4 to 5 infections for 2 consecutive years, again, infections which need antibiotics or leave from school, but for 2 consecutive years, that is again an indication of surgery. And the third thing is if the child has 2 to 3 episodes per year for the last 2 3 years or more, then that also is an indication for surgery.
So basically, what you're saying is recurrent infections
Yes.
is something which an ENT surgeon needs to. You need to visit an ENT surgeon for him to decide when to get tonsillectomy done. And is it possible that after removing the tonsils, they again do grow back or come back? The problem is recurrent.
Yeah, so tonsils are of two types. There are many types of tonsils in the throat, but the main two ones which we address are the tonsils in the throat. Once removed, they cannot come back because they are totally removed.
Okay.
But there's something which is called as an adenoid, which is a tonsil in the back part of the nose.
Okay.
So that, when removed, has a chance of it coming back. So that's something which we always counsel the parents about after a tonsil surgery. So normally when we do tonsil surgeries these days, it's usually a combination of a surgery for the throat tonsil as well as the nose tonsil or the adenoid. So throat tonsils can never come back. The adenoids can definitely come back. Also adding to this, infections was one thing which you spoke about. Another very upcoming or a very common cause why we would get the tonsils out is children's and adults who are suffering from snoring and sleep apnea.
Correct. Yeah, very
Yeah.
important.
So that's one thing which we may not think about even as doctors. We were not that aware till recently that this was one major indication for tonsil surgeries. But what is snoring or sleep apnea? So basically your breathing passage right from the nose to the throat, if there's anything which is causing a narrowing in that passage, which is not letting you breathe properly in the night, and because of that you are having poor sleep, poor oxygen levels, that in short is sleep apnea. So tonsils, if very large, they also obstruct a large part of your
the
breathing
airway.
passage.
Correct.
So if that is happening in a child or an adult, the tonsils need to come out. A child with sleep apnea and tonsils would classically have, of course, symptoms of maybe recurrent tonsillitis, but apart from that, the child is usually breathing from the mouth.
Yes.
The child has snoring in the night. The child will have dental issues. The child will have jaw anomalies where one of the two jaws is more protruding.
Okay.
In adults, they'll have a little different symptoms. They may
Okay.
have things like poor quality sleep. They are tired, drowsy in the day. They nap they're so sleep deprived in the night in spite of good sleep that they may end up napping even in the day while sitting, while
Because
talking.
of tonsils, do the adults also have similar jaw features due to the sleep apnea that is occurring from the tonsils?
No. So your jaw development usually is over by 12 to 13 years, after which there is no major growth in your growth centers.
Okay.
So a tonsil in an adult will not give you those jaw anomalies and dental anomalies.
But will they give sleep apnea problems?
100%, 100%.
Okay.
So anything which obstructs the airway,
Okay.
it could be a tonsil, it could be an adenoid, it could be a tumor. Anything which obstructs the airway can give you sleep apnea, but the symptoms in adults and children are going to be totally different.
Got it.
Yeah.
All right. So, since you mentioned mouth breathing, what are the other problems that could be giving rise to this mouth breathing issue in children and even adults? Because it's a fairly common complaint which is often ignored.
Yeah. So mouth breathing is most common cause, which we already discussed, is the presence of tonsil and adenoids. Apart from that, the other common causes are patients who have nose problems.
Okay.
So you can have a lot of things like आपकी जो नाक की बीच की हड्डी होती है, we call it the septum. So a lot of our patients have septal deviations where the bone is crooked on one or both sides. So the patient or the person is not able to breathe well from the nose, which is why he has to breathe from the mouth. Then the next very, very common cause, which even you as a respiratory physician may be encountering, is allergies.
Yes.
So allergies, allergic rhinitis, allergic pharyngitis, allergic bronchitis, the whole spectrum of allergy disorders, patients have a lot of block, inflammation, congestion in the nose, which gives you mouth breathing. Severe forms of allergies, patients come with polyps, जिसको हिंदी में मसा कहते हैं. वो अगर नाक में है, the patient is unable to breathe from the nose, so they have mouth breathing.
So basically, any kind of nasal blockage is going to make you breathe through your mouth only, because that is the easiest passage.
Correct.
But why is it harmful to breathe from the mouth and not from the nose?
Not from the nose, yeah. So just going back a little bit to the basic function of the nose. Nose आपके body का AC है, or it is a temperature regulator. So if you are breathing in very cold air, the nose is going to make it body temperature warm. If you are breathing in very hot air, the nose is again going to make it body temperature or warm, so that it's comfortable for you to breathe. 1. 2, nose has a lot of defense mechanisms. It has a lot of antibodies. It has a lot of things to stop the germs and dust particles right there. It can filter the dust particles. So nose has a lot of normal functions for breathing. It's made for that. And apart from that, normal nasal breathing also releases an enzyme called as nitric oxide, which is responsible for growth, especially in children. So that is the normal function of nose. So when somebody is not breathing from the nose, all of that is automatically eliminated. Now coming to the problems of mouth breathing. So one is that natural defense is lost. So people who are mouth breathing, they are more prone to get cold, cough, throat infections. So वो first. Second, जो आपकी जो tongue होती है, naturally in the night, the tongue is supposed to rest in the palate. आपके upper, आपका जो तालू होता है उसमें,
the upper part
of your jaw. So the tongue is supposed to rest there and not in the lower part of the jaw for good growth of your jaw, for symmetrical growth of your jaw. If somebody is breathing from the mouth, the tongue of course has to be in the lower jaw to keep the passage open, which eventually also gives rise to jaw problems, especially in children. So that's another problem. And then you have problems like drooling of saliva, dental issues, bad smell, bad odor. We have a lot of patients who actually come to us with halitosis. Halitosis basically is bad odor. So that's from the mouth, and that's socially embarrassing that they say that हम बाहर जा रहे हैं, meetings में जा रहे हैं, restaurants में जा रहे हैं, and people complain that I have a lot of foul smell. So one of the commonest causes for that is mouth breathing.
Oh, is it? Okay.
Yes. So a lot of things linked to nasal breathing, mouth breathing. So if you are somebody who is a mouth breather, definitely at least get assessed once to rule out very easily correctable causes.
Yes, that's one very important point. For all the mouth breathers out there who are taking things so lightly, at least visit the ENT surgeon once to rule out any of these other anomalies or diseases that could be possibly present.
Yeah, and one more thing, I'll just try and make it a little funny. So could you make a snoring sound? Like you see the patients of snoring and sleep apnea. Would you be able to make a snoring sound? So could you just do this like, could you do that?
No, I'm not able to do that.
You could just try once maybe. Okay, so I'll do that again. So my mouth is open and I'm making a snoring sound. So you could hear the loud sound. Now if I'm closing my mouth and if I try to make the sound, I'm not able to make that sound as loudly. So when your mouth is closed, your tongue, your palate, they are more supported. So even the snoring becomes less. So a lot of our patients who don't really have a major problem, but they have just snoring without sleep apnea, where it's just the sound which is troublesome. And if they are mouth breathers, a simple technique of just closing the mouth, either naturally or with the use of some mouth tapes, it reduces the snoring significantly and it helps them breathe much better.
Okay, so just some kind of a tape to keep the mouth shut.
The mouth shut, yeah. Of course, there are a lot of tapes which are available even commercially on Amazon, but you can just use simple medical micropore tapes or even tapes which are available at home. just to keep your lips shut so that you start breathing from the nose.
Interesting. So
Yeah.
this is one way of preventing mouth breathing. Just put a tape on your mouth and try
But
breathing
provided
from
that the
nose.
nose is open.
Yeah.
So you first need to be sure that
Correct.
your mouth breathing is not because of a nose problem.
block.
Then you can do all of
Yes.
that. Yeah.
So my final question to you is: a lot of patients complain of repeated chakkar aana, dizziness, and feeling like they are going to fall quite frequently, and they get their BP checked. The BP is also normal. So this complaint called vertigo, this problem of vertigo, is extremely common in the elderly population also. So how does one deal with this? What would be the causes, different causes for this?
Yeah. So we get a lot of patients so हमारे पास आते हैं कि हमको वर्टिगो है एंड हमारा ट्रीटमेंट चालू है.
Okay.
So first most important thing to understand is vertigo or chakkar is just a symptom of some problem. So vertigo by itself is not a disease, it is a symptom. Just like you have fever in malaria or typhoid, where fever is a symptom which helps you to diagnose your medical problem. So vertigo is a symptom. Now vertigo or imbalance or dizziness or giddiness या chakkar can be because of a lot of causes, and the treatment for each is going to be different. The problem is a lot of times we self-medicate, or in the past a doctor may have given us some vertigo medicines and we end up taking the same ones. Normally we take medicines like Vertin, Stemetil without understanding or without trying to find out a cause, and then we keep taking it on for 10 days, 15 days, 20 days, even a month, and maybe we get better and then we stop it. So that's not the right approach. So if you have vertigo or balance issues, your cause can be anything from your head to toe. So talking about how do we as ENTs differentiate, so first thing what we want to rule out is if a patient is coming with vertigo or balance issues, we first just want to rule out dangerous problems. So what are the dangerous problems? If it is related to the brain, so stroke, uh, where some blood is reaching less to some particular part of the brain, cerebellar problems. These are problems which can also give you chakkar or vertigo.
Okay.
And these are something which have to be immediately dealt with.
Okay.
The other vertigo causes like the ear fluid imbalance, or it's called as BPPV commonly, positional vertigo, vertigo because of BP falling down, vertigo because of, or imbalance or chakkar because of your sugars falling down, or imbalanced chakkar because of spine problems. These are all less dangerous problems.
Okay.
So the main first step is for any doctor, be it an ENT, a neurologist, or even your family doctor, is to just rule out that this is not a brain cause of vertigo, a stroke. Once that is not there, then by careful history taking examination, we can try and find out whether this is because of BP or the ears or the spine or sugars or even vitamin deficiencies or some other medications or alcohol. So there could be many causes.
Thanks a lot, Dr. Sohil, for being on the show and giving us such important insights on topic of ear, nose and throat, which is something that almost every child, every young adult or elderly adult somewhere or the other deals with. And these were small, small things which we need to keep in mind to prevent any major problem that could happen to any of these three symptoms. So thank you again for being on the show.
The pleasure is absolutely mine, and I had a wonderful time discussing these problems with you.
We'll just take one photo.
Absolutely. But before that, Dr. Aditi is putting wonderful medical content out there. So I request everybody out there to like, share, and subscribe her content. And of course, hit the bell icon.